So as you heard from our 1 o'clock release, we have had 2 cases. These are 2 women from the same family, one in her 30s, one in her 40s, who recently arrived here from the United Kingdom. They were tested yesterday, and the test results came in this morning. Both women arrived in New Zealand together on the 7th of June and stayed in a managed isolation hotel in Auckland, and were permitted on compassionate grounds to leave managed isolation to travel to Wellington via private vehicle on 13 June. There was an agreed plan in place as part of the approval process for the compassionate exemption, and that included for the travel arrangements. So they had a private vehicle dropped to the hotel. They then drove together all the way to Wellington and had no contact with anybody else during that trip, and they didn't use any public facilities, and they also have been just with a single family member since they arrived in the Wellington region. At the time, or prior to testing, one woman in retrospect was experiencing mild symptoms, the other was symptom-free. They both had testing done at the Wellington Community-Based Assessment Centre as part of their agreed self-isolation plan. I should say that that was one of the drive-through centres here, and that of course those doing the swabbing were using full PPE. Now, following the positive result being notified this morning, local public health staff are testing and isolating all others who may be at risk of exposure. As I said, in this case it is just the one additional family member. Other potential contacts include people on the same flight from Brisbane and people who are in or who have been in the same managed isolation facility in Auckland, including staff. The contact follow-up is being managed by our National Close Contact Service here at the Ministry, with support from local DHBs, and the local DHBs have already deployed their mobile swabbing team to the hotel, and that is getting underway presently. So staff at the isolation facility, as I mentioned, who had close contact during the period or any contact with the women, will be stood down and tested. And we're also, as we do routinely, viewing footage from the period when those women transited through the border at Auckland Airport to see if there are any border staff who may have been in contact with them and be considered as close contact. If the CCTV footage does reveal that, we will stand those staff down, or they will be stood down and tested. Public health staff have also been in contact with their counterparts in Australia, so they can take appropriate action for any passengers who were on the same flight that the women took out of the UK via Doha and into Brisbane. And I can say now both women are self-isolating in the Wellington region, and we're very confident the arrangements that are in place is the best place for them to be right now. And I just want to emphasise the following point. The family has asked for their privacy to be respected, and please, I would ask that people do respect it. Now, a new case is something that we hoped we wouldn't get, but it is also something that we expected and we have planned for. That is why we have geared up and continue to gear up our contact tracing at a local level and national capacity and capability, as well as having our excellent testing capability so we can respond rapidly. We know there are people continuing to come to New Zealand. These are Kiwis returning from countries where there is active community spread of COVID-19, and that is why we have the requirement for managed isolation at the border. Compassionate exemptions are only granted if there is a detailed plan for self-isolation and testing and health checks in the community as part of the follow-up until the full 14-day period has finished. Everyone that is granted an exemption under compassionate grounds is assumed to present a risk of COVID-19, and all precautions are taken to manage that risk. Obviously, the team here that deals with the exemptions process has a great deal of sympathy for families who are coming to terms with a dying relative or friend or are bereaved. But today's news underscores the recent decision to not grant exemptions to attend funerals or tangihanga, where there may be large groups of people. present under Alert Level 1. More details about the response being taken by our health authorities and advice to the public around the case will be provided in my subsequent updates. So now our total number of confirmed cases in New Zealand is 1,156, and we will report the additional cases through to the WHO. The combined probable and confirmed number is 1,506. We don't have any additional COVID-19 related deaths to report, and of course there is no one in hospital at the moment. Yesterday our laboratories completed 1,527 tests, and the total number of tests to date is 312,648. Just a final comment before I open up for questions. These cases are ones we have identified effectively at the border, and you will recall that in fact we haven't had any cases coming through the border or identified any at the border for some weeks, and it's not surprising we have got cases, especially in this instance where people have come out of the UK, where we know there is still a lot of active infection in the community, and it underscores the arrangements we have in place at the border, including the arrangements in place to manage risk if someone is granted an exemption on compassionate grounds.